Good evening, the aspirants present here. Good evening, Amla ma'am. Good evening, Aman sir. So,
Good
we'll
evening.
be starting with the session. The station for today is communication and it will be taken by Dr. Sangshaptak Saha sir. Sir, you may take over. Aman sir and Amla ma'am, it's going to be an interactive session. So, it's must you can unmute your mics. Thank you.
Hi, doctors. So the mostly what will happen today is that we shall be having an interactive session. So there are two cases for today. So we shall be having like a 20 minutes discussion on the first case with one candidate, and after that we shall be discussing the case about like what went well and what went wrong. So it will be like a you can call it like a mock test only, and the second one but with a like full discussion and follow up. And the second case, the another person will take up the case and we shall be following the same routine, 20 minutes for the like scenario play out, and then around 15-20 minutes for discussion about what went wrong and how to approach such cases. Okay, because in communications there is nothing really to teach as such. It's just we need to practice, and then we need to practice as an active candidate, and the passive candidates also can learn a lot from hearing how it went. So I shall be sharing the screen. So there will be one case, and and I think there are only two candidates. So one of you can take up the first case, the next person will take up the second case. Okay.
Okay, sir.
Yeah. So I think both of you know this. Revised screen. There are two communication stations, 20 minutes each. So communications, and it's only only be an interactive play between the candidate and the examiner. There will be no, I mean, the candidate and the surrogate. There will be no questions asked. So we shall be following the same pattern, and uh, between you two of you just select who will be taking out the first case, and then I shall move on to the next screen which will be showing the case itself.
So I'll take the first one.
Fine. So it's 7:45. So you take 5 minutes to go through the case, and from then we shall start. Okay.
Okay, sir.
Yeah. So there are two slides. This is one slide. Second slide is also of the case. So once you go through this slide, tell me. I shall go to the next slide.
Okay, sir. Sir, can you please change to the second slide? Sir, please, for the first slide also.
Okay.
Sir, should I start?
Yes, you can.
So, hello, Mrs. Debbie Jackson. Myself, Dr. Aman, and I'm your specialty registrar doctor. Uh, uh, I want to talk to you regarding the progression of the disease of yours. So
Okay.
you have been admitted to our site with a history of seizures 3 days back. Can you please elaborate how are you feeling right now?
I'm feeling absolutely fine, doctor.
Okay, so basically, it's regarding the procedure, the CT scan we have done for you for the diagnosis of the symptoms of your seizures. So, do you know about the CT scan you underwent for the seizure episode
Yes,
you had?
doctor. I know that I underwent a scan of the head. That's all I know. I do not know about the reports.
Okay. So, I want to tell you it's sad to inform you that there's something in your brain we get in your CT scan. Are you okay with that? Or do you want someone from your family to be with you right now?
No, I'm fine. You can
Okay.
proceed.
So, we find something in your brain in your scan. Uh, uh, that will be a possibility of a malignancy or a tumor. We will be working on that for future. We will be working for that. We will doing some investigation for that.
I
Are
did not
you?
get you, doctor. Did you just tell that I have a tumor in the brain?
Yes. Sorry to say that we find a tumor in your brain, which is most likely from the previous malignancy you have for your thyroid.
But that
Uh,
was treated with everything that the doctor said. The drugs, the radiotherapy, and the surgery, everything was done. So how do I have a tumor in the brain?
Yes, you have been operated for the thyroid malignancy and you received radioactive therapy also.
Mm-hmm.
But there's a possibility of disease progression and disease dissemination at the time of presentation. So that will be the case that your malignancy has spread to brain at that time, which is now progressed to the fully fledged disease right now.
But the doctor previously had told that this surgery and these things are okay, and I can, like, lead on with normal life. Nobody told me about anything about the progression of the disease possibility, and I think something needed to be told about any follow-ups or something like that. If that was the case, I
Yes,
was not told
yeah.
anything like that.
Actually, generally, the patients for that remains on follow-up for the disease progression. They have to underwent few scans after the therapy and surgery. So,
I underwent the scans. Yes, after the surgery, I underwent the scans. There was no disease.
okay, okay. Anything about your disease, or do you want to ask anything regarding your disease right now?
I am asking that only. I am asking how did I get this tumor in the brain?
Um, there's a chances of the malignancy being undiagnosed or unidentified on skin in early phases. So that may be the possibility that you get the normal skin at the time
So
when you
whose
get the
fault
scans.
is that? I mean, why was I not diagnosed? I did all the scans that were asked of me. It's not like that I did not go to the doctor. It's not like that I did not do the scans. I followed it up. And when the scans were stopped, I stopped doing it because it was not ordered.
Yes, I totally understand your concern, and I totally feel what you're feeling right now. But it's sad to inform you that the scan most likely there is a chance of malignancy with disease progression.
Okay, now I don't know what to say because if the malignancy is spread to the brain, so like that's it, right? And, is not,
No,
I don't think anything can be done after that.
no. We will be performing biopsy of the lesions in the brain, and we'll decide what the further steps of procedure will be taken. Like if the chances of excision of that tumor is possible, then we'll try to get that tumor out of you.
Okay. So you mean I need to undergo a brain surgery?
There may be a possibility of brain surgery for that.
Okay. Okay. So like
Anything,
a lot to
anything?
take up. Yeah, like
Yes.
can I go home right now?
Actually, as you have a possibility of seizures and there is a chances of further deterioration, is there anyone in your family to get you from hospital to your home?
Not right now, but yeah, somebody is coming to pick me up.
Okay. I'll be telling you about the symptoms and what to do if you get in another episode of seizures. And we will be planning your next visit soon so that the investigation for that tumor or the mass will be evaluated.
Okay.
And I will be handing you few of your to-do list so that you won't miss anything regarding your disease.
Okay.
Is there anything I can help you with?
No.
Okay, then thank you. It's good to talk to you, and I will be there for you if you need any help from my side.
Okay. So like, is that the end of the scenario for you?
Uh, yes, sir, sir.
We'll have a lot of time left, right?
Okay, sir. Actually, it's just regarding the breaking the ice of malignancy to the patient, right? Na?
Yeah. But like, you need to ask about the other case things like, right? Like the social history, not the history, but who
Okay,
is
sir.
living with,
Okay, sir.
any work history, any, those
Yes,
sort of
sir. Yes,
things.
sir.
Yeah.
Okay, sir. I am to ask, is there any risky? job you do, or you need any vacations from your work for or that something like that?
I work as a school teacher.
Okay, okay.
Yeah.
Um, that's it, sir. Sir, I didn't think much regarding that also.
So, doctor, you see, there are a few points. Firstly,
Okay, sir.
doctor, have you given the exam before, or will like
No, no,
you
no, sir. This is the first time actually I started preparing for MRCP just 2, 3 months back.
MRCP PACES 2 3 months back, right?
Yes, sir. No, no,
Oh,
sir. Actually, I just started preparing for MRCP. I haven't done my MRCP 1 and 2.
okay, okay. Without, so you are preparing for PACES before you were given part one.
Yes, sir. So I'm doing it alternatively so that I can done it with MRCP 1, 2, and 3 subsequently.
Okay, that's fine. I don't know. So, yeah. So, firstly, you see this communication station. So, what do they expect from out of the communication station? This one, especially this case. So, one is what they have asked. So, what they have asked for? They have asked for this, explaining the diagnosis of cerebral metastasis in a patient with a known case of thyroid carcinoma. So, it's a clear-cut thing, right? That what you need to do.
Yes, sir.
The second thing is that they have basically the same thing and explain the results of the CT scan. So one thing is the CT results, and as you told, breaking the bad news and breaking the ice and those sort of things. The second thing is the hidden agenda. What is the hidden agenda? The hidden agendas are this. So I did not comment on that because there are lot of things that you need to improve on this one. So the
Yes, sir.
patient was admitted in acute medical unit 3 days ago, right?
Yes, sir.
And the CT scan was done at the time of admission, which was also 3 days back, right?
Yes, sir.
And like the patient is expecting to go home later today, and that fine morning, the doctor has come and has announced that the patient has got a brain metastasis, right? That is the
Ye-
scenario.
yes, sir. Yes, sir.
So that is a so if I don't know whether you realize this, but the city head report does not need 3 days to come, right? Everybody knows
Yes.
that. Not even in the NHS, it takes a lot of time to come.
Yes, sir. Yes, sir. I get to know. Yes, sir.
Yeah. So the one grievance, the patient's grievance one was that why has this malignancy recurred? Why has the malignancy recurred, right?
Yes, sir.
Which you tried to solve. So recurred. Another grievance was that why was the city head report not told to me beforehand? And why did it take these 3 days? City head report late. Another grievance was why was I not told that I may not go home today? Why I may not go home today? May not go, sorry, home today. Because with this city report, you are what? You are a specialty registered on the acute medical ward. So you are not a senior person. So with
Yes,
this
sir.
city head report, you cannot allow the person to go home without consulting your senior.
Okay, sir. Okay, sir.
So the patient asked you, right, that can I go home today?
Yes, sir.
You because you have just started to learn, so at least you have learned that point that a seizure patient, you cannot allow the patient to go home alone. You need somebody to bring them home. So that point was good, but the more pressing point was you need to tell that no, you cannot go home right now. I need to discuss with my seniors, and probably a few more tests needs to be done, or you
Okay,
can
sir.
do it on and then the patient would have like the scenario. I wanted the scenario clearly. Then the patient will like, no, I want to go home right now. Why are you doing this? You are telling me I have got the brain metastasis, and no, and I am like emotionally prepared to go home right now. I have lots of work to do at home. I have to go home. Then you would have told that of course you can go home, but we cannot hold you here against your will. but you need to do those tests on an OPD basis at least, that is on an outpatient basis at least. So you would have spent a few more minutes in that.
Okay, sir.
The fourth thing was the thyroid surgeon or the endocrinologist, whoever has taken care of the patient, right? Or the
Yes, sir.
radiologist, not the radiologist, sorry, the nuclear medicine person, whoever. So a
Yes, sir.
referral to that person needed to be given. The fifth point is very important. You ask the patient that there are some points which I would like to tell you, so which you need to follow when you have the scissors, which there are some points which need to do what you need to do when you have this medicine, so that you need to increase na. So that you need to tell that yes, if because sometimes seizures can happen without any prodromal symptoms, and
Yes, sir.
sometimes seizures can happen with some prodromal symptoms like a headache, like
Yes, sir.
some color flashes in front of the eyes, right?
Yes, sir.
Like
Yes,
some
sir.
unusual smell, etc., etc. Do you have this when you seized? If he tells that, then okay. So if you ever have those features again, immediately sit down wherever you are, and immediately, if you can, tell the person around you that you have a seizure and to call for the emergency number, right?
Yes, sir.
I think that is what you wanted to tell the patient. So you need to tell that patient. Otherwise, you will finish in 10 minutes, and then the remaining 10 minutes you will just sit quietly.
Okay,
Because
sir.
in
Okay, sir.
PACES, what happens is that in the if you are finished before your allocated time, they will not speak anything. You will need to sit in that room in front of the examiner for the remaining 2-3 minutes. That,
Okay,
believe
sir.
me, that is very difficult.
Yes, sir.
Okay. And I mean, of course, you will learn a lot as you go on, and you will not wait for that time, because invariably you will have a less amount of time to finish the task.
Okay, sir.
But I'm happy that you are such a newcomer. So, I am able to teach a lot of things.
Yes.
I'm really happy. Shaving oil for 8 months. Okay. So, another thing was the follow up.
Yes, sir.
So, she needs a follow up at this thyroid clinic and those sort of things. Also at the neuro clinic, right? These sort of things.
Okay,
Another
sir.
thing you missed was the social history. So although it's called social history, but you don't need to take the history. You need to ask a few questions. Suppose you need to ask 5 questions. First is work. I told I work as a school teacher, so
School
there's
teacher.
nothing really extra. But if I told you that I work at the factory,
Sir.
automobile factory, or
Yes, sir.
some factory where there is some heavy machineries,
Yes,
then
sir.
again, you know few things extra you need to tell, that you
Yes, sir.
need to disclose your scissor to that factory. You need to and in case of further scissors, or because there are some guidelines regarding that. If you
Yes,
know
sir.
the guidelines, you can tell what is written there. If you do not know, tell that there are some guidelines. We shall follow up on that. Don't give wrong information. Okay.
Okay, sir.
Yeah. But that is why work is important. Second is driving. Do you drive? Yes. I'm so sorry. You already had a seizure, so it's better if you do not drive for at least a few more time. And again, there are some BVL guidelines. If you remember the guidelines, tell what is there in the guidelines. If you don't remember, tell that is these guidelines. We shall refer to it, and we shall give you the exact duration where you cannot drive, or if you can drive on under what restrictions. That is another
Okay,
thing.
sir. Okay, sir.
Third thing is you can ask about smoking alcohol if the scenario is like that. Here it is not really a smoking alcohol over the scenario, right?
Yes, sir.
Smoking alcohol over the scenario. Fourth is home. Who are you living with? What is the home support? Will you be able to come to the hospital in case of there is an emergency? Do you need any social help? Do you need any occupational help? Okay. And okay, fifth thing is that the last and never the least are the pamphlets.
Yes, sir.
The websites, right? And a follow-up visit.
Okay, sir.
You repeatedly asked about the concerns. I am very happy about that. That is really, really needed. It is the most important thing, what is your concern, what is your you repeatedly told that, so you already picked it up in the last 2 months.
Yes.
That's very good. But all these things needs to be covered in a 20 minutes.
Yes, sir.
Okay.
Okay, sir. Okay, sir. Okay, sir.
And as you move forward in your MRCP journey, in your PACES journey, you realize that in any PACES session, whenever you think that your session is coming to an end too soon, or you do not have to ask anything else, and there's lots of time remaining, always go through the scenario, because the scenario will be given in such a way that you will be able to finish it in exactly 20 minutes, not less than that, not more than that. If you are too short of time, that means you are asking too many questions which need not to be asked. If you have too much time remaining, you are not asking the actual needed questions. Okay.
Okay,
So
sir.
this scenario needed to be tackled in this way. These 5 questions, these 5 points of social history, and the follow-up visits. This follow-up visit is very important here because the patient is angry. Okay. Another thing. So
Yes, sir.
here you are dealing with a breaking bad news. One thing. Another thing was the patient was also angry patient, right?
Yes, sir.
Yeah. So why was the patient angry? Because he or she feels that she was not educated enough to go come for the follow-ups,
Yes, sir.
and she has not been on the follow-up for the last 18 months, right?
Yes, sir.
You and I both know that it's very unlikely that the patient who had gone at thyroidectomy treatment has not been advised for a follow-up,
Yes, sir.
right? But you cannot tell that to the patient because in the scenario it's not written. So what do you need to do? You need to tell that I'm so sorry, I can really feel what you are going through, which you did, and I'm extremely sorry that you did that the follow-ups that as per what you are telling, the follow-ups were not arranged. So let me go through the previous papers. Let me contact your doctor who has seen you at that point of time, or your GP, and we shall come back to it. If the patient is not satisfied with that, tell them that there is something called a grievance cell, right?
Yes, sir.
Yeah. So grievance adversarial committee grievance cell is there. They can make a complaint there, and it will be taken up and will be given extreme importance and urgency, and it will be dealt with that and end it. Once you tell these two things, that you will contact the GP and go through the previous papers, either they will stop right there, or if they don't stop there, take them to the advise them of the grievance committee, and they'll stop. They will not go on. Otherwise they will go on with that throughout the scenario, that you guys have like killed me, it's the end and nothing else to be done. Why do you want to give this these biopsies and whatever you told, why
Yes, sir.
suffering? So they will go on with that, then they will move to the next scenario.
Okay, sir.
So that is the way to deal with the angry patient. Okay. So there are
Yes,
lots
sir.
of things they will see here. They will see that whether you are directly blaming the doctor or not, the previous doctor. You can never do that.
Yes, sir.
Unless, of course, it's written in there that there are no follow-ups arranged. Never do that. Or you can't tell the patient that you are wrong
Yes, sir.
and you miss the follow-ups. Right? And you cannot give them false hope that no, it's something else. You did not give that. You told them it's cerebral brain metastasis and you can go for a biopsy or whatever, and some seniors. And always tell that you shall consult a senior. You shall arrange another meeting with your senior person. Always tell that.
Okay, sir.
And this social history part is very important. You need to see this given case, these hidden things, and the social history, and the follow-ups, and these extra points, angry patients, which was not evident from the scenario, right?
Okay, sir. Yes, sir. Sir, can I ask few things?
Sure.
Sir, actually, as we discussed the case, the patient, as I said, there is a malignancy. The patient, as you said, I had a previous scan and that was normal.
Mhm.
So, is there a possibility that we have to do a repeat scan to clarify it? Can we say that? Yeah, it's done.
No, you
We
don't
have,
tell that. You don't tell that. It is this communication station is not meant to see how well you know about the management of a CT scan head or a metastasis or a thyroid carcinoma. It's
okay, sir.
just meant to see how you are talking with the patient, your communication skills. So do not tell anything that is not mentioned in this background to the scenario. Do not invent things.
Okay, sir. Okay, sir.
Never ever do that in any scenario, in any communication scenario. Do not tell things which are not written here or which are not obvious.
Okay, sir.
Okay. Do not
Sure,
tell
sir.
that you need to repeat a CT scan. That will be the, you will surely fail. Regardless of whether how well you do, you will not, they will not pass you. If you invent information and give something to the patient which is not written.
Okay, sir.
Okay.
Sir, when they said that when the patient was saying that how come
Mm-hmm.
he developed metastasis,
Mm-hmm.
even though he was absolutely all
Mm-hmm.
right last time
Mm-hmm.
and he received complete treatment,
Yeah.
so
Yeah.
that time could we have explained, being a doctor, that metastasis might have sometimes spread through the blood or
Yeah.
lymph,
Absolutely.
then that won't create any
No,
contradiction,
no, no. That
like
would
you
not. That's
said.
what which is obvious. I mean, everybody knows how the metastasis goes, right? It
Hmm.
will,
Yes, sir.
that there is always a chance that few cells have lived, and it has spread to the blood and gone to the brain. At that point of time, when you did the CT scan, it was not there, but after that it developed, and unfortunately, in some cases, the headache or other problems may not appear, and directly the patient presents with
Seizure.
a seizure, as in your, with a fits in your, as in your case. I shall come to the jargon part later. I have made a point of that. And
Okay, sir.
fits, yeah. So you have to explain that.
Okay, sir.
Okay.
Another part, doctor, was the jargons. Of course, you need a lot of practice. You just started. You used jargons like, I shall tell you. You used the word seizure.
Okay, sir.
You use the word malignancy. You can use cancer for that, or you use the word biopsy. So biopsy and scissors are definite jargons, and
Yes, sir.
malignancy is plus minus. But yeah, don't use the scissors is fits. Biopsy is, you shall introduce a needle and you shall take a sample, a tissue sample from the tumor which is in your brain. Okay.
Okay, sir.
Yeah. And yeah, your explanation needs to be a bit better. And repeatedly tell you are sorry, that you are sorry to the bad news. You are sorry that patient has got a brain mets. You are sorry that the patient had a thyroid carcinoma. You are sorry that the patient did not understand that the patient needs to come to the follow-ups. Okay, repeatedly tell sorry in this scenario, because it's a very bad thing to disclose with a 30 years old person, right?
Yes, sir. Sure. Yes, sir. Yes,
And
sir.
offer some water, offer some tissues.
Okay, sir.
Yeah. And during the breaking the bad news actual, what you said was, there is a tumor in the brain. Do you want anybody else to come to the room to discuss?
Yes,
So
sir. I did, sir.
yeah. So
Yes.
it needs to be the reverse. You need to tell that we have done a scan of your brain. We have the report with me, with us, and I shall be telling the findings. Before that, are you comfortable with doing this session alone, or do you want somebody else in here today? And then they will tell something. They will tell, obviously, that just tell me the result, and then you can tell that, I'm so sorry, ma'am, we have got some very bad news for you, and tell the news directly. Okay.
Okay, sir.
Don't
Okay,
tell
sir.
that there is a tumor in the brain and then tell something else, because that does not make sense.
Yes, sir.
So how I would have started, so this scenario has got three parts. Any communication scenario has got three parts. One, two, three. One is the how you start the scenario. The second part is the rest of the scenario, and the third part is the end. So the end is the follow-ups, the pamphlets, and a bit of a concise briefing of what we have discussed. So, ma'am, so how I would have gone through here was that. So, ma'am, what we have discussed today, we discussed your CT scan reports, which unfortunately shows some tumors in the brain, and the you had a scissors, and we have already prescribed you some medicines you need to take at home. You need to be on regular follow-ups. We have shared some pamphlets and papers which you can read, which will give you some extra information. And in case the patient has gone for that the grievance addressal form or that thing, then you can tell that we shall give you the form, or we shall make them available to you, and we shall take that up seriously. Anything else, and the patient will know, and then end the scenario. So always keep the last 1 to 2 minutes for this ending part at least.
Okay, sir.
Yeah. And the start take a good 1 to 2 minutes for that, because it's a 20-minute session. You have a lot of time. If you take 2 minutes there, you will have 16 minutes here.
Okay, sir.
And how do you start the scenario? You will start like you enter the room, you tell that, good morning, I am Dr. Sangshaptak Saha. I am the register in the unit today. Am I talking to Mrs. Debra? And you are 45 years old, ma'am? Yes. Okay. So, ma'am, can we start the meeting? Yes. Ma'am, and they are only ask, are you comfortable with meeting the me in alone, or do you want somebody else in the room? And end the thing there. Then you tell that, ma'am, what I read from your reports was that, because you were directly talking to the person, so no need to tell that you had a seizure and those things. You can tell that, I have read the reports, you had a fit at work 3 days back, and I'm so sorry to hear that, but fortunately you are doing better now. Is that right? And you will tell, yes, it is right, and I'm ready to go home right now. And then you can tell that, ma'am, unfortunately I have got a CT scan reports with me, and there are some issues which we want to discuss. And then the surrogate will tell that, oh my god, what is it? And tell the report that there are some tumors in the brain which is possibly a metastasis. By metastasis I mean that the cancer cells have spread to the brain, and I'm so sorry to hear that. And give a pause, and then let the person react. What the reactions can be: sad, offer them handkerchief tissues; angry, let them vent out the anger. Don't try to control them there. Once because they will stop, right? They are very trained actors or actresses, so they will stop after 30 seconds of venting out their anger, and then tell that, ma'am, I'm so sorry. I can understand your concerns, and right now I do not have the reports of your previous examinations, right? So what I shall do is that I shall go back and I shall see whether when is the last follow up or was it advised or not. I shall contact your surgeon, your GP, and I shall see how is it, and I shall get back to you. Still angry? Again, let them speak. 30 seconds gone. Let it go. Then again speak. Then, okay, ma'am, I can understand how concerned you are, and I'm so sorry that you have to go through this. There is something called a patient grievance addressance form. So I shall send it to you. You can fill it up, and we shall take the matter in the next meeting very urgently, and we shall give a great importance to this. Rest assured, we take up this. We have got this annual meeting, not annual meetings, sorry, weekly meetings, where you take it up, and senior persons deal with these things. And if there is any lag in the system, then we shall definitely rectify, so that you or anybody else do not have to go through this again, and that will be the end of it, right? So, and then the rest of the scenario will play on very smoothly, because now the patient, you have gone to a good start, you are confident, the patient has vented out the anger, that is the end. So now, two person who you are relaxed, the patient is not angry, they can speak regarding a diagnosis, regarding a follow-ups, regarding how sad they are, regarding the social lives, regarding their work life, regarding their drivings, regarding their any other things that they can tell. And then again, at the end of the 16 minutes, again, so we have discussed it, as I told, a concise brief and the end of the scenario. Thank you for the meeting. We shall be seeing you in the follow-up clinics, and that's it. Okay.
Okay, sir. Sir, should we tell about the prognosis of that metastatic
No,
carcinoma?
no, no. You don't need to tell a
Okay,
prognosis.
okay, okay, sir. Okay, sir. Thank you, sir. Thank you, sir.
So what about admission and discharge?
Admission and
Hello?
discharge.
No,
Yeah.
no,
So
no.
as I said,
The patient is doing well, was about to get discharged is the question. It's
yeah, I
written in the
understood.
question.
I understood. You
So
cannot
we can
discharge the
send him home.
patient. No, you cannot. That's what I told.
No,
That you
your question
cannot.
has been labeled there, no, sir. You mentioned the point that he's doing well. You just read the question, sir, that full paragraph, and that
Doctor,
last that is
doctor, let me tell you. I can understand
yeah.
what you are. So as I already told, maybe expecting to go home later today. So as I told, the patient cannot go why I may not go home today, because the candidate needs to explain to them that once they have asked that can I go home today, then the candidate needs to tell that unfortunately your discharge needs to be postponed. Then the patient will ask why, and then the candidate needs to explain that unfortunately with these reports, because it's a new development, so right now I cannot let you be discharged. I shall speak with my seniors, and then the patient can react in two ways. The one way is that okay, they are okay with it. Let me stay one more day, and you don't need to comment on that. Another part is that the patient may react angrily once again. Okay, yeah, angrily once again that I was planned for discharge. I am having this brain malignancy, whatever you are telling. There are no follow-ups. I am, it's a negligence or whatever. And now you're not sending me home. Why is it? Then you can tell that I shall immediately bring my senior once this meeting ends, and they will have a talk with you, and they will take the final decision. Because why? Because you are the specialty registrar. You are not a senior person. You do not
Okay.
have the right to discharge the patient.
Okay.
Only the consultant has the right to discharge the patient. And the consultant maybe does not know, because if the line was written here that the consultant knows about the CT scan report and have agreed for discharge, then you could have discharged the patient. Okay. So
Got it, sir.
anything that the patient asks which is not mentioned in the scenario, you either need to, explain it if you can, which is logical, like how did the metastasis go to my brain? Then you can explain that by blood it went, because that's how it goes. Everybody knows that. You don't need to consult a consultant for that. But anything else, any extra information you cannot give to the patient. You need to tell that another meeting with my seniors, or I shall discuss with senior and come back to you, something like that. Don't give extra information to the patient which is not written in the scenario. Okay.
What about radiation term for layman, sir? Radiation therapy.
Radiation term is that there will be some radiation chemotherapy. Radiotherapy is mostly you can tell, but yeah, radiation layman term is I don't remember right now, but I think you can tell radiations also, because mostly the people will know. Like chemotherapy is like cancer medicines, so radiation will be like some rays which are used to nuclear medicine. You can tell nuclear medicine which is used to treat cancer. Okay. So I think some people have joined. So next will be the second case, unless somebody else has got some other questions, or we can take the question at the end of the second case also. It's not an
So there
issue.
were some questions regarding surgery for the metastasis. The doctor also asked about it. Should we talk like that, or should we avoid talking like that?
Yeah. So the patient has already undergone the thyroidectomy, right?
Yeah.
Yeah.
No, surgery for the metastasis.
Surgery
There
for the
was some
metastasis, it's not
during discussion.
mentioned here. Yeah, it's not mentioned here. But so as I told the candidate that don't tell about the biopsy or any intervention procedure which is not mentioned here, because those things are very specific. It may not, maybe that the patient is beyond any surgery or something like that, which is there is no clue given at all, because just the diagnosis has appeared on a CT scan. So it's better not to tell about the biopsy or the metastasis or the surgical removal, those things in this scenario, because this scenario is not about the management of the metastasis. This scenario is about explaining the diagnosis and counseling the angry patient. The angry patient is a major point here, because the patient is angry about a lot of things. The patient is angry that there were no follow-ups. The patient is angry that the patient has got a bad diagnosis. The patient is angry that the patient is not be able to go home as previously expected. So it's basically a case of an angry patient, and that's why I picked up this case, because once you read through these two scenarios, you will not be able to get that angry patient vibe here, right? But that you will understand as soon as you enter the room. So there you immediately need to change your approach, because these questions you can prepare outside. CT results, malignancy record or not, this you cannot. Thyroid thyroid surgery, endocrine nuclear medicine, follow-ups, social history, and pamphlet. These things you can prepare. But this third point, the angry patient point, you cannot predict from outside. So you need to be malleable. Once you go inside and find that you are an angry patient, immediately you need to treat that angry patient first, because immediately you need to give importance that that management of this angry patient is the one which you will be judged upon throughout the scenario, rather than how will you deal with the metastasis, because the scenario is not regarding that. Okay.
Sir, though it's a breaking bad news situation, a station, should we ask the patient about how was your life for the last 18 months? In an
Yeah, you can.
approachable, just going, getting into the groove, sir, before opening a bad news. Can we ask how was your life for the last 18 months? How did you do? Did you do
It's
well on
in
those
this
things?
scenario, because the patient is waiting for the CT scan report, so it's better to give the diagnosis first. And
Okay.
once you are dealing with a social history, there you can ask that how have you been doing last 18 months, have you been working, and then the rest of the things will follow. Okay.
Okay,
Don't
sir.
ask that previously. I mean, at the start of the scenario, don't ask about that, because the patient had a seizure at work, so obviously she was working, right? And so deal with those things first. In the breaking bad news, always break the bad news first. After that, you can go with the rest of the scenario.
Thank you, sir.
You're welcome. Okay. So I think another person should take up the next case. Anybody, just select yourself, and 20 minutes, 5 minutes reading time, 20 minutes we shall prepare, and at the end we shall have a discussion for similar to this case. We do not have a fixed candidate, okay? So one of you needs to volunteer. So just one of you just unmute yourself and just take up the next case now. And like it's a practice session only. So there's nothing right or wrong. We shall have a discussion then anyway.
Sir, should I go again?
Yeah, sure. I mean, I don't think the others are willing to, give in, so you can go, because there's no point in me wasting time.
Okay.
Yeah. So this is the second case.
So should I start?
Yeah, you can start.
Okay. Hello, Mr. Neil. Myself, Dr. Aman. I'm your specialty registrar. May I know your age and registration number?
Okay, I'm like Mr. Neil Kinan. I am 53 years old.
How are you feeling right now, Neil?
I'm feeling better.
Okay. Is there anything of your concern right now?
Yeah. So the thing is that I am a person who do not want any blood transfusions, right? And from what I learned today with the nurses speaking around me was that I was given blood transfusion yesterday. So I want to know
Yes.
that without my consent, why was they given blood transfusion?
Okay. Actually, you presented to our emergency in a very severe condition. You had an episode of massive hemoptysis, and the BP was very low, and you were drowsy. So at that time of management, we have to transfuse 2 units of blood for your stabilization. And after that, the thing went stabilizes. Uh, and at that time you were drowsy, so we can't get your consent at that time.
So like without my consent, how did you give the blood?
Without your consent, actually, as I said, you were present to our emergency department
No,
in
that I
down.
understood. I was very sick, but I also did not give any consent.
Okay, that will be the need of the need for your stabilization and uh,
Okay, move on. We shall discuss about this later.
okay, sir. Okay, sir. So basically, this morning we get your blood test report done, and you have a hemoglobin of 4.7. As
Is that low?
yes, that is very low. That comes under severe condition, and
What is the
as
normal value?
generally the normal value for male is 13 gram per deciliter, and you are having 4.7 gram.
Okay.
That comes into severe condition. And as discussed with your consultant, we are planning to get you another unit of blood transfused.
Never. I shall never give the consent for that.
Can you please tell me what is the concern of yours so that we'll work on that?
I don't want a blood transfusion, but how will it help me?
Actually, right now, 4.7 is very severe form of hemoglobin right now. That will lead to further deterioration like tachycardia, volume overload.
Tachycardia, doctor.
Sorry?
What is tachycardia?
Tachycardia will increase heart rate. You will have
Okay.
palpitations. Yeah, you will have your heart rate running very fast. You can land up again into low BP and drowsy condition. So
That's
that will
okay. I don't mind dying. If the no blood transfusion means I shall die, I am okay with that.
sorry to hear your how you feel right now. Can you please elaborate why are you having such thoughts right now?
I don't want to live.
Can you please tell me further how you feel about that?
Okay. So the doctor, you see, I am having a lot of trouble in a lot of things. So, I am feeling a lot. I am feeling very low, and I don't want to live.
Can you please tell me much about your personal life?
You see, this patient, you are in a chamber. You
Yes,
are
sir.
speaking to this patient.
Yes,
He
sir.
is clearly telling that he does not want to live. Repeatedly
Okay.
asking him why you don't want to live will not help the matter,
Okay.
isn't it?
Okay. Yes, sir.
So
Sir, I
ask
don't
something
know,
else.
sir, how
Why
to
does the
proceed with.
person, this person is clearly depressed, right?
Yes,
So
sir.
why can a person be depressed? Either there is something with the work, or with the family, or with something, anything else that is going on, any the alcohol smoking, because the pattern is same.
Yes,
You
sir.
need
Yes,
to
sir.
ask the same questions. If you are not reaching anywhere with the sort of question, just leave it. Ask something else, because
Okay.
they will not tell the answer unless you ask those questions.
Okay, sir. So, sir, as I ask you, can you tell me further about your personal and work life? So that will be helpful.
Doctor, I do not have any personal life because I do not have anybody at home. My wife has left me. I do not have any children, and yeah, so the personal life is very bad. And I mean, I do not have any of it. And also the work life, I lost my work around 2 months back, and I have been unable to get any job. Also, my pet died recently. I have taken on alcohol. I am smoking lots of cigarettes. I know that I shall have cancer, but I do not want to live. So, having a cancer will not affect me in any way. And I also know that, these drugs, I am also into drugs. I've taken, those drugs in my blood veins a few times. I know that is possibly not legal, but I've done that. And I always think about my wife, my parents, my dogs, who all of no, none of whom are there right now. And I have also lost my job and all this constant thing here. So you see, nobody will nobody will tell you this. Why am I telling you this? Because once you ask in general about the personal and family life, and if the candidate immediately, I mean the person immediately tells you everything about the family life and the personal life and the pet life and the work life and the alcohol history, smoking and the addictions, everything, you
Yes,
will
sir.
not be able to get the answer. So what is the way? The way
Yes, sir.
is ask separately. Whom do you live with? When this happened, where were you? Maybe they'll tell I was on the road. So I'm so sorry, but what do you work? And then they will give you the work history.
Okay,
Where
sir.
do you
Okay.
live? Is there anybody else with you? They will give you the family history.
Okay,
Okay,
sir.
so sorry, wife has left. Okay, do you have any children? No. Do you have anybody else, your parents or anybody, loved ones, brothers, sister? No. Okay.
Okay, sir.
So you have
Okay, sir.
lost your work recently. Have you got any recent jobs? No, I don't. I'm jobless. Okay. Then, and in the middle of this, they will tell you something about the pets who have also died. and then again ask about, do you smoke, do you drink alcohol? Then they will give a detailed history again. I smoke this, I have increased it, I am totally alcoholic, I am taking this much of alcohol every evening, and then totally drunk. And that's one of the reasons actually why I lost the job, and I'm feeling very low. Have you gone to a psychiatrist, or have you not, sorry, not like that, have you gone to a counselor?
Social help.
Have you,
Okay.
yeah, have you taken any help? No, I have not. So with this, what are your positive points you are getting? Like, suppose you are asking, do you do any job? No. Have you got any jobs after you have lost your job? No. So okay, we have got something called employment, sorry, we have got something called a employment help
Support system.
association, yeah. So we
Okay.
can refer you to that, and they will help you with that. Or so that is one thing. Second is, I have a very poor family life, so nobody else to take care at home, so you can refer you to social services, maybe they will help you out with that. Okay.
Okay, sir.
The
Okay, sir.
third is, yeah, the third is the smoking thing. So you have got a smoking cessation clinic. The fourth is alcohol. We have got an alcohol anonymous groups, or we have got a these citizen anonymous groups. You know, so those sort of things you can refer, or we have got a clinic here also. Where you can refer you. Then the drug problem, we can refer you to the concerned clinics, the drug
De-addiction.
yeah, the de-addiction clinic, the rehabilitation clinics.
Okay, sir.
So this question is, I mean, once I'm obviously you started 2 months back, you'll not be knowing this, but
Yes, sir.
this question, a practice candidate, whenever they will see this question, this line does not have anything to live for, they will immediately know that they have got a very easy scenario. Okay, because
Okay,
for
sir.
every problem that the person will tell you, you can show how you are dealing with. You will show your empathy or sympathy. You
Okay,
will
sir.
tell sorry, and you will do something for them. Social services, employment agencies, de-addiction centers, alcohol anonymous centers, etc., etc., etc.
Okay,
Smoking
sir.
cessation clinics. Okay,
Okay, sir.
so that is how you'll do. And the, of course, the help counselors, the psychiatrists. Okay,
Yes, sir.
that also needs to be told. And because this patient will not take up blood unless, because this patient, you cannot force this patient any blood, right? And the
No, sir.
4.7 gram per dl, you will know the patient is going to heart failure or in a acute kidney injury without the blood. So
Yes, sir.
you need to explain that also, that you will get breathless, you will have, racing pacing of your heart, you will have some pain in your chest, you will feel very low, you may faint, you may have some seizures, your major organs may stop working, and you may need to be put on a machines, and you will be very sick, you may die. And if you deal with those, what you told in the social history, those things well enough, then at the end of the scenario they will accept that, yes, okay, give me a blood, maybe with those help, I can get my life back on track. And even after explaining, they don't accept it, what is your purpose, you can tell that, okay, I shall inform my senior, they will also have a chat with you, right?
Sir. Sir,
Yeah.
how to respond that the patient said, you transfused 2 unit without my consent at time of presentation?
Yeah. So you see, the patient was drowsy, right? So the
Yes, sir.
patient, there was no way to go, they have consent from the patient. So that is when done in the patient's best interest.
Okay, sir. Okay, sir.
Yeah. So the doctor has the right to
Okay.
act, unless, what is the exception? Unless the patient is a known case of Jehovah's Witness, the patient has a tattoo on the back or on the chest or on the forehead, or there is a bracelet on the arms or any prominent part of your body where the Jehovah's Witness is written, or no blood transfusions, official legal document signed by the patient in a complete mental health is written and signed. Okay.
No, sir, I didn't get any, sir, any of this, sir.
Okay, so
Uh,
you need to go through this. So there is something called Jehovah's Witness.
okay,
Jehovah's
sir.
Witness means that you cannot transfuse blood to this person. So if you find out that this person is a Jehovah's Witness, and
Okay,
it's written in a big way, you know, a tattoo on the front or tattoo on the back, which the patient, and these questions scenarios have come. I am not inventing these scenarios. Okay,
okay,
this
sir.
scenario, Jehovah's tattoo written as a tattoo on the back of the patient, and in the ED, the patient's shirt has been removed and the doctor has seen the tattoo and then given the blood. That is not to be given. So
Okay,
this
sir.
was the scenario. Okay.
Okay,
So
sir.
if it's obvious, then in those scenarios you cannot give the blood. There can be a bracelet where it is written that this patient is a Jehovah's Witness, this person Jehovah's Witness, do not transfuse blood. Or there is a person with the patient who is showing a document, a legal document, where the patient has told that if I am unable to give the consent, do not transfuse the blood in any scenario. You cannot give the blood. You have to let the patient die because the patient has given the consent in his or her full medical capacity, full mental capacity. It's like
Okay,
putting a
sir.
patient on a ventilator. If the patient has opted, I do not want a ventilator for myself or for this person. If the person is unable to consent, you cannot put a patient on a ventilator. You cannot start a dialysis, right? It's similar for that. But here, there is no such thing. You have received a patient, hypotensive, tachycardia, drowsy, hemoglobin low, you have transfused the blood. It's absolutely legal. Nobody can blame you for that. Nobody can sue you for that. The
Okay,
patient
sir.
can become angry, that's fine. But it's not illegal. It's the right thing to do, and by right I mean it's a legal thing to do.
Okay, sir. Sir, what about the if the patient close relative differ or refuse to get any treatment for the patient? So
Nobody,
should we?
nobody can differ, or the
Okay.
UK laws are very strict. It's
Okay, sir.
I don't know from which country you are from, but it's not
India
like
only,
the
sir.
okay. It's
Yes, sir.
not like the Indian laws, the where the next of kin can give a decision. I do not want a dialysis. I don't want dialysis for my parent, for my uncle, or whatever.
Yes, sir.
So if the patient is of an adult patient, and suppose their patient is an adult patient, okay, the
Okay, sir.
patient is to be put on an invasive mechanical ventilation,
Okay, sir.
and there is nothing there. The patient is like not in a condition to refuse or give consent, and there is no patient's relatives available. You can put the patient on invasive mechanical ventilation
Okay, sir.
because that again will be in the patient's best interest.
Okay, sir.
Now, suppose the patient has got a relative.
Okay, sir.
There is no legal document. The relative is saying that he has told when he was in his full uh, consciousness that I do not want a mechanical ventilation. That does not mean anything.
Okay, sir.
Okay. So only if there is a legal document, that means something. That is one thing. Second is, unless that patient has made that person the patient's legal deputy, that is a person who can take all decisions for that patient when the patient is unable to take the decisions, then that patient can ask you that do not put this patient on invasive mechanical ventilation, do not put this patient on dialysis, do not transfuse blood for this patient. Okay.
Okay, sir.
So that is a legal guardian like sort of thing. And if that is a thing, it will be explicitly mentioned in a scenario, or the candidate or the I mean not candidate, the surrogate will explicitly tell that I am the legal guardian. And they will tell that I have this document. Legal
Okay, sir.
document. Okay.
Okay, sir.
So now in the change scenario, the thing is that in the communication part, the questions cannot be asked, right? So the questions are initially asked on two things. What are the legal aspects of the scenario? What are the the social aspects of the scenario? So the legal aspects, social aspects, those will not be asked, but those will be tested in the scenario itself.
Okay, sir.
Yeah. So of course you need a lot of practice. You are not prepared at all.
Yes,
I
sir.
won't.
Yes, sir.
I know. I'm sorry. I won't sugarcoat things.
So what are the
You
legal
are not.
aspects tested here, sir?
Yeah, I shall tell them. Just a minute. Hmm. So the aspects that is tested here is quite fine. One is that what to ask the legal aspect, that whether the patient's relatives, that whether the doctor was right in transfusing the blood or not, right?
Yes, sir.
And yeah, and the social aspect was autonomy. The patient is not allowing the blood, right? Now the patient is in full senses.
Yes.
Yeah. So that was one thing. But there are four things in each. Just give me a few seconds, okay? Yeah. So the legal aspects are, first is consent, whether there is a valid consent for that, and who can give the consent. For the consent, the Mental Capacity Health Act needs to be satisfied. The Mental Capacity Health Act was done in 2005, and if the patient is in full mental status health, then they can give the consent. And if the patient is like under the influence of alcohol, is like sick enough, is in drowsy state, obtunded state, then the person cannot give the consent. And unless some previous directives are there or the legal guardian is present, the doctor can take the best decision for that person. That is same as India and UK. Okay, so that is one thing. The second thing is the confidential. So one thing is consent. The second thing is confidentiality. What is confidentiality and how is it applicable? Like if we're asked that a person has been diagnosed with a disease called HIV. Okay, and during taking the history or during the session, you realize that the person's wife does not know about it, or the person has got a few sexual partners in the last 2 months and they also don't know about it. Then it is the patient's duty to inform it to the wife or to the or to those partners. And if the patient refuses, then it is a doctor's responsibility to inform it. But it is only in these very few cases, like diagnosis of some communicable disease, which needs to be informed to the communicable disease section of the UK. So there is a list in the NICE guidelines. So just go through that. This is like tuberculosis, HIV, right? Amoebic dysentery is one of them. Malaria, dengue, all of those are noticeable, I mean, notifiable diseases. So those there you can break the confidentiality and you can disclose. Another thing is the driving, which I told in the last case, that if the patient is unwilling to disclose it to the DVLA, you can, as a doctor or the from the medical part, somebody can disclose it to DVLA. This patient has a seizure. This patient has a heart failure. This patient has a HOCM. This patient has a recent stenting and is not fit for driving for this month as per the DVLA guidelines. The patient was unwilling to tell you guys, so we are informing you. So there you can break this confidentiality and you can disclose the information. Otherwise, you can never disclose the information to anybody else, basically. To the patient's family, son, daughter, father, mother, wife, uncle, aunt, anybody, best friend. Nobody can, you can disclose if the patient does not want it. The third is end of life care, DNI, sorry, DNI decision, DNR decision, these sort of things, which we shall discuss in details in another session. Then there is a medical negligence and error, which a bit we discussed in the last case, but there are bigger cases which are separate cases completely on that. And the fifth one is the Mental Capacity Health Act itself of 2005. So these are the 5 things which mostly test your legal things.
So what is EOLC DNI? This I didn't listen to it.
EOLC is end of life care.
Okay.
Yeah.
Do not
So
DNI?
yeah.
Do
So
not
basically,
intubate and do not resuscitate.
intubate, do not resuscitate. So that
Okay.
needs to be legally documented previously. Otherwise, a sick patient who do not have anything, nobody can tell that DNI or DNR is there.
Okay.
Right? It needs to be documented, or needs to be documented there and signed by the next of kin. By next of kin, son, daughter, wife, father, mother. Okay. Yeah. And all of this needs to be done in a case where there is futility is there. So a young patient or whatever, a 60 years old patient has a heart attack and you do not want to intubate the patient, and the patient do not have any advance directive or any legal guardian, and the person who is standing next to you wants a DNI for that patient. and then the doctor can take the decision. So those you need to decide with the questions, and the 5 minutes you'll get before the session starts. What is the scenario? That is a bit, you know, you need to see that needs to be on a case to case basis. It's not something absolute. So in this case, these legal things are very important. So which are the things legally discussed that needs to be taken into account, because that will be the focus of the case. As I told in last case, the focus was the error, or the patient was angry. It may not be an error, but the patient thought it was an error. So here also, this consent and this mental capacity health act, mental capacity act 2005, these things were the important things. And also the patient thought there was an error, right, which was not actually an error. These things are tested here. So if anybody has any questions, then you can ask me. Our sessions, I don't know when the next session will be, but our sessions will be like this only. We shall discuss one or two cases, and we shall be discussing what are the possible questions that can be asked, what are the ways that you can improve yourself. So of course that will be better for if you are actively participating. If you are listening to somebody else, that also is an excellent way to understand and improve your communication cases and skills. But yeah, do try to take part in active the discussion also. So Sana, are you there?
Sir, actually, sir, I want to ask you.
Yes.
So basically, I'm from India, and we generally
You're
don't
Dr. Aman,
practice.
right?
Yes, sir. Yes, sir. And we generally don't practice all such things in our daily practice. So, as I'm preparing for PACES also along with my first and second step, do you suggest anywhere I can go through, yeah, any videos I can see, so that will be helpful for further evaluation and further things to be done?
Yeah. So basically what you need to do is that you need to go through these. Okay. So one is the past test videos. The past test videos are mostly for the clinical skills, but they've also got the communication videos also. So you can go through those. And for reading purpose, it's Rupa Basant and the cases for PACES. I myself did this, and those are excellent materials. Okay. Apart from these, there are some things called I mean, I don't know whether you'll be able to get them online or not. I have them. So this is my number. You can just drop a message, and I can share the things with you.
Yes,
And
sir. That will be very helpful if you can
I'm
share.
writing it down. So take a screenshot or note it down, because I have got some PDFs of the station 4 as such, the Rose PDF and then some things which I collected just before the exam. So that basically covers all the cases that you can ever get in communication. And I think 50 cases, 50, 60
Okay,
cases.
okay,
Yeah.
sir.
So once you go through that, you will have a very good understanding of how to approach and what to ask, and more importantly, what not to ask. And in the 5 minutes that you'll get before the scenario, you need to write it down on a piece of paper what you will do once you're inside the station, because there can be some hidden things like what happened in the case 1. Patient is angry, that you can't predict outside, but
Yes,
the
sir.
social history points, the family history point, not a history wise, as I told you how to ask those things and how to explain the diagnosis, how to show the empathy, get a brief background, and of course dealing with the angry patient, which is a new thing which will get inside. Here also, you could have, what I would have thought was that why does the patient not want a blood transfusion? Anybody who has practiced for PACES will know that this patient is depressed, because it's clearly written there that he does not want to live. So
Yes,
what
sir.
can be the causes? So this can be the causes. Usually in the case there'll be a one or two causes which you need to evaluate in detail. They will not give everything. I told you everything, right? No
Yes, sir.
family, no pets, no jobs, drug addicted, smoker, alcohol, etc., etc., etc. Those sort of things. So that you need to find out one yourself when you're waiting for the scenario. And also, what are the legal aspects that they can test here? What are the social aspects that they can test? What are the, not the social, what are the ethical aspects they can test here? So always go through those patterns, because that's how I prepared, and I believe that helped me a lot, because I practiced on my own only, from reading those scenarios and then practicing on my own, playing the role of both the candidate and the surrogate. I'm asking something and I'm replying on my own also. So that helps you understand how well you are doing. And at the end, if you just make a record of that scenario, 10 minutes, 12 minutes scenario on your own, and you play it back, then you will know that you yourself will understand that this was possibly not to be asked at that point. Maybe I could have gone a bit soft here. Maybe I could have shown a bit more empathy or a sympathy here. You'll understand when you practice it on your own 5 to 6 times.
Okay, sir.
So I don't know when the next class they have given me, but we shall practice something on the end of life care, and one on in detail about brain death, because that is one thing where you are expected to know a few things. That is one of the scenarios, and it's a bit different. Both the scenarios are a bit different from the other scenarios. Okay.
Okay, sir.
Yeah. So unless somebody has some questions, we can end the session here. And Sana, are you there?
Yes, I'm here.
Any? Yeah. Okay. So from next time, what we will do is that we shall, select the candidates who will be actively taking part. Okay.
Yes.
As we discussed over the phone, we shall select 2 candidates, and they will do it. And as in today, others can join when we are discussing at the end of the scenario.
Sure.
Fine. Okay. I hope
Thank you.
that session was helpful for you guys.
Yes,
Okay.
sir. It
If
was
you
helpful.
guys
Thank
something
you.
else,
Very
yeah,
much, sir. Very
yeah,
helpful,
it's
sir.
okay. It's okay. If you guys want something else or some different approach, you can message me or you can tell Sana, and I shall try to include it on the next session also. See you soon. Bye.
Thank you.
Thank you, sir. Good night, sir.